Worldwide, it is estimated that more than 500 million people are living with diabetes. Around 30% of these patients develop a diabetic neuropathy, where nerve damage usually starts in the feet. 15 renowned experts from all over the world met at an international consensus conference to discuss and develop recommendations on the best practice in screening, diagnosis, and management of diabetic neuropathy in clinical practice.
Diabetic polyneuropathy is the most frequent microvascular complication of diabetes, which is observed in approximately 1/3 of all individuals with diabetes, and perhaps half of these have neuropathic symptoms, including pain, while the other half remains largely asymptomatic. This is one of the reasons for the high rate of undiagnosed neuropathy of up to 80%. Another issue is that the available guidelines on the diagnosis and treatment of diabetic polyneuropathy are either heterogeneous or even confusing or incomplete by focusing only on certain aspects of the condition. And we therefore took a holistic approach to provide consensus recommendations covering all relevant areas and define algorithms for screening, diagnosis, and treatment of polyneuropathy that are relevant specifically for clinical practice based on the available evidence and also on the experts' personal experience where evidence was lacking.
We must not forget that foot problems are very common in diabetes, and so is diabetic neuropathy. One of our studies, we showed that up to half of older patients with type 2 diabetes have significant neuropathy. Half of these patients may not realize that because they have no symptoms. Therefore, screening for neuropathy is absolutely crucial to identify those people who are at risk of developing foot problems. And neuropathy itself is one of the most important contributory factors in the causation of foot ulcers. So screening and early treatment of neuropathy may help to reduce the incidence of foot ulcers, which themselves sadly may ultimately require amputation, and of course this has significant morbidity and mortality.
One challenge is that half of the patients remain asymptomatic and therefore need to be examined and not only ask for symptoms. Another problem is that different nerve fibers are involved, large fibers, small fibers, so that a single test is usually not sufficient to diagnose the neuropathy. So in many settings, you need a set of tests, but there are many of them and they are not sufficiently standardized, so that the question arises as to which tests are most appropriate. In this regard, the consensus report gives distinct and condensed practical recommendations and algorithms for the physician to be able to decide which tests should be preferred and how exactly they should be used in clinical practice to diagnose the condition as early as possible.
During the COVID-19 pandemic, people with diabetes have been understandably rather frightened to come to hospital clinics. They realize that people with diabetes who get COVID, they don't do as well as those without. And indeed, in my country, 1 in 3 of people dying in hospital with COVID has diabetes, type 2 mainly. So it's absolutely essential for people to continue attending, to be looking after their feet, to looking after their neuropathy. And even though we've done a lot of telemedicine for the proper diagnosis of diabetic neuropathy, one really needs a good clinical examination of the foot and also measurement of simple tests for sensation, what they can feel, motor tests that are outlined in the guidelines. So these are crucial. And hopefully people will be less frightened to attend clinics now. In most countries, things are gradually improving. And of course, we encourage all our patients to be vaccinated.
I think it's very important that patients who attend the diabetic clinic should have their shoes and socks removed for clinical examination of their feet, at least on an annual basis. The great Paul Brand, who did so much for the management of the neuropathic foot, remarked, removing shoes and socks to examine the foot is the most important step.
Clinical diagnosis of diabetic neuropathy is based on neuropathic symptoms and signs. Typical neuropathic symptoms include pain, paresthesias, and numbness, particularly in the feet and calves. The basic neurological assessment comprises the general medical and neurological history, inspection of the feet, and neurological examination to assess, for example, pain, sharp sensation, and vibration sensation.
The management of painful diabetic neuropathy is extremely challenging for clinicians, partly because the individual drugs that we have limited efficacy. Each individual drug can only help patients up to 40% of our population, and the majority are not helped by single drugs. And also we have limited data available on combination treatment.
The management of diabetic neuropathy includes 3 cornerstones. First, lifestyle modification, optimal diabetes treatment aimed at near-normal glycemia, and multifactorial cardiovascular risk intervention. Second, pathogenetically oriented pharmacotherapy such as alpha-lipoic acid and benfotiamine. And third, symptomatic treatment of neuropathic pain, including analgesic pharmacotherapy like antidepressants, anticonvulsants, opioids, capsaicin 8% patch and combinations if required, as well as non-pharmacological options.
I think this consensus report is very useful for the practicing physician. It tells you how to diagnose the painful and painless DSPN effectively and how to manage it. Also, it allows a stepwise approach to the treatment of painful DSPN, if necessary, with the use of combination treatment. Different treatment approaches are considered, and tips are given on how to optimize these by looking for side effects and by gradually titrating the doses of these drugs.
I think the most important aspect is the holistic approach, considering not only, for example, symptomatic pain treatment, but also including the concept of pathogenetically oriented pharmacotherapy. Another advantage is the use of a structured consensus filing process by applying the Delphi method. Last but not least, we give recommendations owed to the current topic of COVID-19 pandemic against the background of the increased risk of in-hospital mortality, foot complications, and amputations among diabetes patients with COVID-19. So I do hope that these straightforward and distinct recommendations will be helpful for the physician when diagnosing and treating patients with diabetic polyneuropathy in daily clinical routine.
The consensus report is published in the scientific journal Diabetes Research and Clinical Practice and is available online with free access. For more information about the consensus report and information for clinical practice, please visit the Wörwag homepage.